The American Academy of Pediatrics is now officially recommending drugs and surgery in the treatment of obese children. So to me, this is now falling into that category of other health issues for kids that we describe under bad biology, bad genes, or bad luck, when, in fact, those things do play a role, but it's mostly lifestyle and environment factors that play a role. Meaning if you can change the environment, if you can change the behaviors, then the condition goes away. And this is really important because while I have nothing against drugs and surgery, in fact, I've benefited greatly from both, drugs and surgery rarely get to root functional causes of the illness. And this is important, especially when you're young and you have a lot of life left to live. It's really important to start looking into root causes versus maybe someone at the end of their life where drugs and surgery might make the most sense. Again, because if there are consequences, and a lot of times there are with drugs, it's the cost isn't as high as when you're young. Now, there's other, I think, health conditions that we also have been, well, let's say we normalize them for kids. It's just like, this is bad luck or bad genes. And that's things like vision. Crooked teeth can fall under this category. Brain imbalances, ADHD, anxiety, depression. Even things like flat feet. So, for example, you have flat feet. It's like, oh, no, you have bad luck. And so they recommend orthotics, right? And orthotics act as this almost like, it's like a back brace for your feet. It's doing the work of the musculature that should be active. We forget all the time that feet, your arch specifically, is layers of muscle stacked on top of each other. Like 4 layers of muscles that you can train, right? And if you don't use your muscles, they atrophy. So in this instance, orthotics actually make the root condition worse because you have flat feet, because you have weak arches. Orthotics then further weaken the arches, making the problem worse, making you more dependent on interventions. And so my concern for this is that's what we're going to do. We're going to do drugs and surgery as an intervention to help with obesity, because obesity is something we need to do something about. There's a lot of health consequences potentially for someone down the road, or even in their youth. So you don't want to just start treating symptoms right away when things can easily be done. And when it comes to obesity, there's a lot of factors at play, more so than just diet and activity, although those are important and should be addressed. But there's other things like environmental toxins or microbiome health, for example, hormonal health. All of these play a role. So mental health, right? Adverse childhood experiences also can play a role in metabolic health for kids and even adults. So my hope is that we look more into this and don't just settle into drugs and surgery. That's the way to go for these kids.